Horizontal Phaco chop. With horizontal Phaco chop techniques, the nucleus is divided into two fragments using a chopper moving in the horizontal plane. After being placed at the lens equator under the anterior capsule, the chopper moves toward the Phaco tip, which has been impaled in the center of the nucleus. When the chopper reaches the Phaco tip, both instruments are moved apart, leading to mechanical division of the nucleus. In this video, we would like to discuss horizontal Phaco chop during Phaco cataract surgery. You can find the links to other videos on similar topics in the description of this video. You can also find the links to the instruments used in these steps in the description of the video. During horizontal chopping, the nucleus is secured between the chopper and the Phaco tip, which makes this technique less dependent than others on vacuum level. The capsulorrhexis must be 5 mm wide to allow surgical maneuvers to be performed without causing damage to the capsule. Hydrodissection is mandatory, and hydrodelineation is advisable. The sleeve of the Phaco tip must adapt perfectly to the incision size to avoid fluid leakage through the main incision, an important issue when using high vacuum. The sleeve must be retracted backward to expose at least 1 mm of the metal tip so that it can penetrate the nucleus. Before the tip is impaled, the superficial epinucleus should be aspirated. The chopper is introduced through the paracentesis by turning it laterally, as the tip length measures 1.25 to 2.00 mm. Once the chopper is in the anterior chamber, it is placed in the capsular bag at the lens equator, opposite the main incision and in the same meridian. To place it safely at the equator, first it must be turned left with its distal end parallel to the anterior capsule. When the dull end reaches the equator, the chopper tip should be turned to the right so that the distal end embraces the lens. It is important to ensure that the chopper is located beneath the anterior capsule, otherwise, the zonules or the anterior capsule will be torn during chopping. To impale the Phaco tip, the surgeon should start stabbing the nucleus from the proximal edge of the capsulorrhexis, pointing toward the nucleus center without going beyond the proximal half of the nucleus. During this step, high vacuum and floor and burst ultrasound are used. Once maximum prefixed vacuum is reached and the tip is occluded, the foot pedal is changed to position 2. Next, the chopper is moved toward the Phaco tip until they are close. The instruments are then pushed apart laterally, leading to the mechanical division of the nucleus. Subsequent divisions are accomplished after the progressive rotation of the nucleus so that the face of the fragment to be impaled is parallel to the transverse surface of the Phaco tip. The harder the nucleus, the smaller the fragments and, consequently, the higher the number of fragments. For a medium nucleus, 4 to 6 pieces should be created. The fragments are then emulsified. Hope you find the video useful. Please let us know in the comments other factors which you think are also useful for horizontal Phaco chop. Please let us know the other topics on which you would like to see similar videos. Check the description below for a link to other useful videos and instruments mentioned in the video.